This is actually a review of literature looking at the relationship or possible relationship and link between atrial fibrillation, vascular disease, and endothelial dysfunction. I'm Michelle Corbin. I'm one of the advanced interventional fellows in structural heart disease at Mayo. And I'm the first author on the new article that's going to be appearing in Mayo Clinic Proceedings, entitled Atrial Fibrillation and Endothelial Dysfunction, a Potential Link. The highlights is that there is a mechanistic links between endothelial dysfunction and atrial fibrillation suggest a potential vascular dimension to atrial fibrillation pathophysiology. The association of AFib and stroke may also be mediated or worsened by vascular endothelial dysfunction. And then last, the prognostic role of endothelial dysfunction, early detection and treatment on incident atrial fibrillation and stroke needs to be further evaluated in depth in future studies. Now, we know from prior studies that there is a bidirectional relationship between AFib and endothelial dysfunction. Prior studies have shown that patients with atrial fibrillation, they develop systemic endothelial dysfunction, and this could be related to turbulent coronary flow related to atrial fibrillation, which also affects nitric oxide production, secretion, and therefore leads to endothelial dysfunction. In addition to that, there is also another direction between endothelial dysfunction and atrial fibrillation. So what we know from prior studies, some of which have been conducted here at Mayo, is that patients with atrial fibrillation and systemic endothelial dysfunction who have underwent AFib ablation, they tended to have a higher rate of AFib recurrence post-ablation, which also links systemic endothelial dysfunction to the development of atrial fibrillation. There are also other mechanistic links that we discuss in the study, in this paper, that also shows the relationship between atrial fibrillation and endothelial dysfunction, both at the level of the atria and at the level of the vascular endothelial dysfunction. We also have recently published a paper from our group showing also that if we take a cohort of patients with chest pain and no obstructive coronary artery disease, and we do a invasive coronary activity testing on these patients, those patients with coronary endothelial dysfunction, they have a 5.8-fold increased risk of developing incident atrial fibrillation in a 10-year follow-up period, with about an 11% absolute risk increase in this patient population compared to those patients with normal endothelial dysfunction. Our article highlights 5 different mechanistic links between atrial fibrillation and endothelial dysfunction. The common systemic risk factors associated with systemic inflammation and oxidative stress. So age is a very strong risk factor for atrial fibrillation. It's also a risk factor for endothelial dysfunction. Similarly, hypertension, obesity, obstructive sleep apnea, even hyperlipidemia, which are all risk factors for vascular disease, are also risk factors for atrial fibrillation. And all of these risk factors culminate into systemic inflammation and oxidative stress, which actually leads to AFib and or endothelial dysfunction. And the relationship here between these risk factors and the development of AFib and endothelial dysfunction could either be a linear relationship, where you start with risk factors and you develop endothelial dysfunction followed by AFib along a certain continuum, or it might be actually the same risk factors leading to those 2 different entities. The answer to that question is not yet fully understood. The second mechanistic link between vascular disease, endothelial dysfunction, and atrial fibrillation is actually myocardial ischemia. The third mechanistic link that we talk about in this paper is about common gene variants that actually are related to both atrial fibrillation development and endothelial dysfunction. The fourth mechanistic link is vascular shear stress, and we know that vascular shear stress, which is the force exerted, the tangential force exerted on the endothelial cells by the blood flow and the effect of AFib on this turbulent flow and the shear stress, both in the atria and in the vessels, actually could be related to the development of atrial fibrillation and link atrial fibrillation and endothelial dysfunction. And then finally, we also talk about another link, which is specifically called fibroblast growth factor 23, which is also a potential link between these two entities. So it's interesting to learn from the sub-analysis of the ASSERT trial in the past that the relationship between that there is no temporal relationship between stroke and rhythm for patients with atrial fibrillation. And therefore, the relationship between stroke and atrial fibrillation might be actually explained by endothelial dysfunction, whereas endothelial dysfunction we know is the earliest clinically detectable form of atherosclerosis. Finally, we also include in the paper a table that actually outlines the common effective therapies that have worked for atrial fibrillation and actually their effect on endothelial dysfunction, both systemic and coronary endothelial dysfunction. So basically what this table shows is that almost all the therapies for atrial fibrillation that are known to date, including the risk factors control to rhythm control by Afib ablation, they actually have an impact on endothelial dysfunction. And this is really very intriguing and actually calls for larger randomized controlled trials further investigating the effect of Afib therapies on endothelial dysfunction and vice versa. Therapies for endothelial dysfunction that work for or prevent development of atrial fibrillation, both pharmacologic and non-pharmacologic interventions. And finally, I hope that you find this primer video interesting and actually will prompt you to read this paper and always give us your feedback. We certainly hope that this paper will set the stage for future research in endothelial dysfunction and atrial fibrillation to further investigate this vascular new dimension for atrial fibrillation pathophysiology and the relationship between the vascular, this vascular disease and atrial fibrillation. Thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.